Welcome back. Now, the Health Ombudsman says that allegations by broadcaster Tom London Holmes against his treatment at Johannesburg's Helen Joseph Hospital are largely unsubstantiated, although the hospital is in dire need of renovation. Now, the Office of the Health Standards Compliance and Health Ombud released the findings of an investigation that was done into allegations of bad treatment by health workers. Last year, a video surfaced of Tom London making allegations of bad treatment at the facility, including by medical staff. But for more on this matter, we are joined virtually now by Health Ombudsman Professor Taole Mokoena. Professor Mokoena, pleasure having you. Welcome to Morning Live.
Thank you, Sakina.
Prof, just going back to that video that obviously made headlines, that went viral on social media platforms, Tom London, who was a patient at the Helen Joseph Hospital, and he then sent out this video lamenting his experience at the Helen Joseph Hospital. And you found largely the allegations were unsubstantiated, but perhaps let's walk through how you reached that conclusion.
Thank you very much, Sakina. Now, first of all, I think we must separate the allegations that he made into two. One are the allegations about clinical treatment, and the other is about the hoteling aspect of the hospital. Now, if we start with the clinical aspect, is that he complained that he was made to wait for a bed in the wards for a period of 3 days while he was in the emergency department, and that was true. That he did stay that long, and many a patient has also been afflicted like that. I'll say afflict because the emergency department is not designed for hoteling. It is what it is. It's an emergency department. People get triaged and then be sent to different parts, including those that need to go to the ward. They go to the wards. So we found that that was true. And part of it is that well, one is that the hospital is full, and secondly is that management is not managing that issue. In other words, they're not releasing or discharging patients timeously, so that there's no backlog and backup in the receiving part, which is the emergency department. That's one. Now, the other clinical part that he complained about was that the doctors treated patients like cockroaches. Now, we interviewed other patients, some of the patients that were lying in the same bed, in the same ward as he was, and none of them confirmed this kind of attitude or treatment. The only thing that we could confirm is the attitude of one doctor, named doctor, that he complained about, that the doctor just came to his bed and started looking at his hospital records without greeting him or acknowledging him. That is true. However, that doctor gave an excuse or a reason as that there was a teaching tutorial that was going on at the next bed, where the medical students were being taken for a lesson, and she didn't want to disturb them. So that much we established. But otherwise, he himself, when we interviewed him, because we started interviewing him before we did any of the other interviews and investigations. He said that he doesn't have anything to blame the hospital about the clinical care, and in fact he went out of his way to praise the hard work of the nurses and also the treatment that he received from the doctors. Certainly, he named a couple of doctors, one at the emergency department and one in the ward, that he was very impressed about. That's number two. Number three is that he also said that the people at the X-ray department, they forgot to give him a radio contrast or a dye, as he called it. And then he impugned that this was inefficiency and so on. But fact of the matter is that the doctor that looked after him had asked for a non-contrasted CT scan. But the radiologist who was interpreting the X-rays, the CT scan, felt that it is necessary to get a contrasted scan, and he was called back from the ward into the radiology department to undertake this radio scan. So the actual clinical treatment that he received was appropriate and adequate, except that when he was being offered surgery, he declined that and refused and left the hospital to go to private practice, to private hospital rather. So that's the clinical side. Now the hoteling was most of the things he complained about were substantiated, including the peeling of paint in the ceilings and the walls, the broken basins, the rusted bathtubs, and the non-working plugs and so on. Those were substantiated. Remembering that hospital was built in 1944, so it's exactly 80 years ago, and certainly it hasn't received any refurbishment or proper maintenance for the past several years, for the past few decades. So the edifice is beginning to crumble.
Professor Mokoena, also with regard to staff shortage at this particular facility, because unfortunately, before and after Tom London's post, if you go onto TikTok, without any fear of contradiction, something about Helen Joseph is bound to come up. And, there are lots of complaints. This is a facility that is in the catchment area to serve a population of 1.5 million people, but they only have 604 usable beds. So clearly there will be some constraints if a large number of people need facilities to be made available. But with regard to staff shortages, can we speak to that particular aspect, given that this does, of course, make life difficult for the staff that is there if they are burdened because apparently there's a vacancy rate of 437 vacant posts at that particular facility. I don't know if that is correct, but what did you find in that regard?
I think we should approach this in two ways. One is that Helen Joseph was, until a decade ago, designated as a regional hospital. And then it was then upgraded, so to speak, into a tertiary hospital about a decade or so ago. Now, the two types of hospital require different staffing norms and also equipment. Now, up to now, the hospital has not received neither the staffing that is aligned to the tertiary work that it is doing, nor has received adequate equipment for tertiary. So that alone creates, if you assume that the staffing was complete, it was completely and fully staffed for a regional hospital, there will still be a lot of deficiency in the staffing for a tertiary hospital. That's one thing. Now, the other is that even if we look at the regional hospital staffing norm, there is a 30% shortage of staff currently. So it is a compounding issue that even for a regional hospital, it is understaffed by 30%, but already not receiving enough staffing for a tertiary hospital.
And that, of course, is a huge problem. Also, you highlighted, Professor, among other issues to be dealt with, the CEO who's in an acting capacity. They've had about 4 of those in 5 years, things like that. Also, an artisan who would be at the facility full-time to take care of some of the maintenance issues at that facility. Again, when one looks at the broader picture in Gauteng, for example, how would you describe the situation and how should the department deal with this going forward?
Well, there are several issues to address this. One is that the Gauteng Department of Health ought to make sure that the staffing is correct. Not only the staffing for professionals and allied staff, but also at the management level. Now, if there's no stability at management level, one cannot expect, and therefore you do get breakdown in the services because there's no authority. There's no effective authority. So what we recommend is that Gauteng government must prioritize the filling up of those management posts, including the CEO. And then the other thing is that you need professional staff, especially nurses. Those posts need to be filled as well, because the shortage, the increased burden, it leads to a burnout, and when people suffer from burnout, they make errors, and so that's very important that they should address these issues.
Professor, we have to leave it there, but thank you so much. I think we need to make more time to speak to you as the Health Ombudsman regarding some of the broader issues here as well. But thank you so much, Professor Taole Mokoena, the Health Ombudsman, speaking to us about the findings into the state of Helen Joseph Hospital following a complaint by Tom London.
Yeah, right. We have to leave it there. And also just to let you know that there has been a bus accident on the R24, a devastating accident. It appears that 12 lives have been claimed from this accident. So this is on the road to the airport at OR Tambo International Airport. So R21, R24 split northbound is closed at this point, but the agenda will have more on that story.